Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. Today's segment's first off, a dire warning about medical tourism in Florida. There's a lot to break down there, and you're going to want to hear it. Then, an MTV VJ opens up about her regrets regarding screening and treatment of breast cancer. And then finally, liposuction. What is the risk of injury to your intestine or your organs? Pretty crazy stuff. We're going to talk about all of that, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in, and special shout out to people on X who I hopefully might be seeing this live now. Welcome. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the amazing Sarah.
Hi.
Hi, Sarah. In the box, we got Travis.
Hey,
how
are you?
Buddy? You doing good?
Good.
Having a good week?
Yeah, I cannot complain. How about y'all?
Yeah, doing good. It's Friday, man.
Yeah,
I love
and
Fridays.
You have black hair.
I have black hair today.
You need to tell us what's going on with that.
Oh, you know what's coming up. It's my favorite holiday coming up, right?
Yes.
Halloween. Remember last year I had the blonde hair?
Oh, yeah, you did.
I was Ken last year.
But you dyed it that color,
yeah, this
right?
Oh, this is dyed. You think it's my natural color?
No, but it's dyed?
Yeah, it's permanent dye.
Are you serious?
Yeah, why not?
Oh my
I can't
gosh.
change my hair color? So we always go all in on our Halloween costumes.
I thought it was like spray, like you
No,
spray
it's
painted
like
your
legit.
hair.
This is me for a while, at least
my
for a few
God.
weeks. Yeah, you don't like it? You hate it, don't you?
No,
You don't?
it's fine.
So it's the 25th anniversary of The Matrix this year.
Okay.
So we're going to be Neo and Trinity. And even cooler, one of my friends is going to be...
What does Neo look like?
Keanu Reeves. You haven't seen The Matrix?
Well,
Travis,
yeah.
please tell me you've seen The Matrix.
Yeah, I've seen the Matrix.
Okay.
I
Keanu
haven't
Reeves?
seen it in a while.
Oh my gosh. Well, you're about to like...
But I thought he didn't. I thought he had like a buzz cut or something.
Well, yeah, like when he was in the war-torn future, but like in The Matrix, he had this like awesome black hair. It looked just like this.
Oh, I guess I don't remember.
She not a Matrix fan,
I guess not. And we got a friend who's going to be Agent Smith, but Trey,
Mm-hmm.
will you be my Morpheus?
I cannot.
Dude, I'll take the pills, I promise.
I cannot.
No, all right.
Aren't there two different colored pills?
I think, yeah, there was a red pill and a blue pill.
Yeah.
And I can never remember which one's the good one. Like, I always like mess it up, so I'm not even going to say. I think it's the red pill. Is that the good one? I can't remember.
I mean, I don't even know the characters, so.
Oh my gosh. Trey and I are going to talk about The Matrix for a little bit, Sarah. It's all good. Hey, I said last week for the fair. Everybody, you go to the fair yet?
No.
Do you not go to the fair? Trey?
Yeah,
fair?
I've actually been twice at this
Okay.
point. So tonight I'll be going again.
Oh,
This
you
will be
going
my-
tonight?
Yeah, this will be
Dude,
my
all
third
right,
time.
I'm about to lay some really good advice on you. Now, I thought this was crazy when I heard about it, but I kept hearing about this cotton candy wrap bacon.
Oh yeah, I tried it the first time I went.
Oh, you did? I thought that
Yeah.
was new. Oh, wait, you mean you went 3 times this year?
Yeah, I went 3 times this year.
Oh, I thought you
I'm
you've
sure
been
it
3
was really
times
good.
total.
No. 3 times this year.
Dude, my wife was telling me about this cotton candy wrap bacon. I was like, that sounds terrible. And then I ended up eating like 4 of them. Like, it was the best thing I've ever put in my bacon hole.
I put brown sugar on bacon.
Yeah, it's basically the same
Yeah.
thing. Yeah, I get that now. But when you hear about it, it's like, I don't really love cotton candy, but I do love bacon. And I was like, well, how's this going to work out? But
Yeah,
it
I'm not a
worked out.
cotton candy fan either, but it was really good.
Yeah, it was, man. I was just like, I was killing those
I
cotton
heard
candy
that
bacons.
I heard the food prices were up though. Like
Man,
they're
the
pretty
fair is
expensive.
expensive. Yeah, that's a
More
downside.
expensive than they usually are.
Yeah, the bacons are like $14 or something. Yeah, I'm like, I have to get a job driving for Uber so I can get more than bacons.
Oh my gosh.
All right, let's move on to some segments. We got some pretty interesting things today. And these are actually, every segment today comes from a news story that I found. So first one's a pretty sad story, actually. This comes from a woman in Colorado named Miriam Al-Daraji. And she has a pretty dire warning about medical tourism in Florida. And I want to actually show the video because it was a kind of a long video. I edited it. I still think it's a couple minutes long, but there's some really like crazy information in here, and then we're going to break it down. So Travis, go ahead and roll that video.
Around 14 million people people travel across the world to receive medical care, seeking other cities than their own to go under. Well, tonight, Karen is sharing one Colorado woman's warning after she hopped on a plane for a mommy makeover in Miami.
2 weeks earlier, she and her family were in Miami, Florida. She'd found a board-certified plastic surgeon at Seduction Cosmetic Center who would perform what's often called a mommy makeover.
I was looking for a better body for, especially after 4 kids.
The family had arranged to stay for 5 days following the surgery. There were early signs of problems with the incision, which had turned hard and black. But Miriam says doctors told her it was just dry skin and sent her home to Colorado with an antibiotic ointment.
I was like, nobody's willing to touch me, not even in urgent care. What's going on? They are telling me that it's necrosis.
She says while the out-of-state cosmetic center continued to deny any problem, her stomach felt as though it was eating away at itself. Desperate, she reached out to Dr. Samir Hassan.
Not everyone's going to just say yeah, because 1, they're afraid of liability. 2, they don't necessarily always know what it is.
Despite his own concerns, he agreed to help. He found the necrosis was at her abdominal wall and would soon reach her organs.
She potentially would have ended up in a hospital.
Miriam has since had multiple surgeries to fix the botched tummy tuck and has spent countless hours searching for some way to hold the surgery center accountable. Attorneys saying we will not be able to help you.
It really depends, because Florida does not necessarily require its doctors to have medical malpractice insurance.
Raj Chauhan is a legal analyst for CBS Colorado. He says attorneys may be hesitant to take these cases because without malpractice insurance, they say it is just not economically feasible. For Miriam, she signed a document that explained that risk, and every attorney she contacted refused to look at her case. Still, Florida continues to see a jump in cosmetic tourism every year, with out-of-state patients flying in from across the country to go under the knife. Many don't always know what they're getting into.
Most of the people who are marketing themselves as plastic surgeons, they're cosmetic surgeons, and that means you didn't have to go through plastic surgery training.
The appeal largely comes down to cost, which experts say should be your first red flag. While Miriam did research the center online, she found only positive reviews, which she now believes might be fabricated. Today, she struggles to lift her children at times and is fighting a new anxiety about her body.
I wake up in the middle of the night, being traumatized, hoping that it's not ripped open again.
And while she may never see justice in a courtroom, she believes sharing her story will serve as a warning to others.
And stop them from what they're doing.
Pretty crazy stuff, right?
Yeah,
That's
stuff we've been preaching about for
it's a crazy story.
the existence of this show.
I know. I mean, well, obviously that's one of the main reasons we do this show, is just to warn people. And I was sitting there listening to that, and they were talking about how Florida is such a hotbed for plastic surgery. And honestly, I think that one of the biggest drivers of that is just the laws there are just so bad for patients, good for doctors, that you get these places popping up.
That whole malpractice.
Oh my gosh. Yeah.
Insurance liability situation.
Yeah, absolutely. I'm glad you remember that. So there's a lot of things that I want to talk about directly from that article. I mean, I've been talking out about the risks of medical tourism for a long time. And I mean medical tourism both out of the country and in the country. It's worse out of the country, but it's also not good in the country. And I think especially in Florida, I mean, I hate to say it. So she went to what I like to call a plastic surgery mill. So it's not like she went to Bruce Hermann, MD. She went to a place, I forgot, like Seduction or something. Like when you go to a place like that, you are going to a corporation and you lose a lot of that doctor-patient relationship.
Yeah.
And that always, it puts you at risk. When you don't have that great relationship with a doctor that spends time with you to talk you through the procedures, talk about risks and things that may happen, I mean, it just puts you up at a higher chance of having a bad outcome. They sent her home after 5 days. Most complications that are going to happen, especially with something like a tummy tuck, are not going to happen super quick.
Yeah.
To me, the biggest risk of tummy tuck is exactly what happened to her, which is bad healing of the incision. Now, that's really, really bad. That would be a very kind of extreme.
That was pretty quick, though.
Yeah, and that means that the injury was very severe. A lot of times what you'll see is a more smoldering course where the incision does okay for a week and then it tries to have problems. And another reason why medical tourism is, not a great idea, especially for something big like that, most times you don't even know anything's going wrong until after you're long home. And then at that point, you're on your own. She talked about how no one would see her, and that holds true a lot of times, because most plastic surgeons, if I get a call from the ER, it's like, oh, so and so's here with a complication, I'm like, we'll just send them back to their surgeon. But in these cases where they go out of state, that's not an option.
Yeah.
And so I end up seeing a lot of these people, because if somebody goes out of state or out of the country and they're having a problem, I will see them. A lot of people will not, because there is liability in it. Like, this is a bad outcome. There's going to be a lawsuit. And a lot of doctors are like, I just don't want to be a part of it, no matter what happens. Even if you're like, being the good guy and stepping in.
Right.
I do want to say just something interesting. This is like not really a risk, but throw up that other picture I threw up, Trelva. So that was the picture of the necrosis. So one of the reasons she had a problem, so the black arrows are pointing at the normal tummy tuck incision. Those red arrows is a vertical up and down incision. That's from where her belly button was when they released it from the skin, and when they pulled it down, she didn't have enough skin to get that belly button hole below the lower incision. And so they had to do a little inverted, I call them inverted T incisions, which you can kind of imagine those two incisions make like a T. It's like an upside down T.
Yeah.
And that does put you at risk for healing problems. And and this is another thing where like doctor-patient relationships is important, because I can always tell when that's going to be a risk. And I talk to patients about that, and I say, look, you either have like a short abdomen or you don't have a ton of loose skin, and there's a chance I won't be able to get the belly button hole in the part of the skin that gets removed. And if I have to make that little vertical incision, it puts you at a little bit increased risk for healing issues. Now, this is obviously an extreme case of that, but I don't know, I just picked that up when I saw the video, and I was like, oh, I'll just kind of mention that. If you have a complication from medical tourism, just like this lady, had, it could require hospital stays, multiple surgeries. They were talking about how most people do this, to save money, and these, plastic surgery mills can, because they pay the doctors less, and oftentimes they don't use anesthesia, they can charge cheaper prices, and that attracts people.
Yeah.
But then if you have any type of issue whatsoever, all that savings is gone.
Right.
I mean, her bill's going to be, tens of thousands of dollars,
Right.
For what happened to her.
I think it's all this like lack of accountability, because like right
There
now
is.
we're talking about the business, the seduction plastic. We don't even know the doctor's name.
Right, and I
So
looked
he
him
could
up.
just go work somewhere else and do
that
the
Dr.
same stuff.
Hassan, like, I don't want to like give a shout out to Dr. Hassan. I don't know that guy, but like, like me, he's willing to see these patients who are kind of, in a bad spot, and I applaud him. One of the things he brought up, which is brilliant, is when you go to these places, a lot of times they're not even real plastic surgeons. And I actually looked up that place, and they had some real plastic surgeons, but they also had some non-plastic surgeons that were part of their cosmetic surgery staff. Like, these are people that are not trained in plastic surgery. Like, it's just crazy. The other thing that was super, super important in that segment was when they were talking about these places not having malpractice insurance.
Yeah.
We did a whole segment about that a few months ago, where in Florida there's no law that you have to have malpractice insurance, which is mind-blowing, because what happens is these places will just not have malpractice insurance, and they make people sign a piece of paper that says, hey, we don't have, I'm sure they don't say it in a way that's alarming, but they sign these waivers, and if they don't have malpractice insurance, like, attorneys won't take the case.
Yeah.
Like, you could be botched all to pieces, but no attorney's going to take it, because the laws are so restrictive on what they can get awarded in a malpractice suit, outside of insurance. And if they don't have any insurance, then these people will just declare bankruptcy and end up not paying nothing, and the lawyers know that. And so the lawyers absolutely won't take the cases. It's the biggest scam I have ever heard of. Like, the Florida Medical Board should be ashamed of themselves.
Yeah.
Like, it's just, they are not protecting patients. And, I don't think a month goes by when we don't talk about some bad outcome coming out of Florida.
It's like that whole situation just supports like
it
bad
supports
outcomes.
bad behavior.
Yeah.
Absolutely. And the other thing too, when she was talking about that she thinks that the reviews for that place were fabricated. I mean, I know that happens. I mean,
yeah, you can pay for
reviews, and people can have a great website and have these reviews that say, oh, this is the greatest place ever. It's very difficult, and I think especially in Florida, but even in places like Texas, it's very difficult to tell who's legitimate and who's not. And so, stories like this are important. I feel terrible for this lady, but her sharing her story hopefully will get out there, either via that news article or from this segment.
Yeah.
And just be a warning to people that, one, medical tourism is risky. and two, you got to do your research and where you're going. And it's complicated. I feel bad for people. Like, I've talked to doctors who don't know the difference in like what a certified plastic surgeon is versus not.
Yeah.
So
it's really scary that people are one that's like that desperate. Because like whenever I think of things that are discounted prices, it usually comes with an issue. Like looking at clothes that are on a discount. Like you're not going to be surprised if it has like snags and stuff like that.
Right,
so it's like, why would you take that risk with your body?
I know, like, when it comes to your life, you don't want to, go to the lowest bidder, I don't think.
Yeah.
It's like, they say that about like rocket ships and surgeons, you don't want to go to the lowest bidder. I mean, it's scary stuff, and I just feel bad for people like her, and, we do these segments to try to educate people about what to look out for, and hopefully the message will get out there. And I really do think Florida should look at their laws. Like, the whole thing about the malpractice is just bonkers to me. Like, there's just no excuse for that. Florida should really, be ashamed of themselves. So, all right, I just want to recap this segment real quick, Trey. Today we were talking about a dire warning about medical tourism in Florida from a lady in Colorado who traveled out there to get a mommy makeover. She had some pretty serious complications from a tummy tuck. The place where she went just kind of blew her off and sent her home, and then she started to have really bad problems. And come to find out that she really didn't have a lot of options in her hometown because no one wanted to see her because it was someone else's complication. She finally found a very nice doctor, Dr. Hassan, who took care of her and got her squared away, but it took multiple surgeries, a lot of time, a lot of money, and unfortunately she has very little recourse to go after the place because it seems like they may not have malpractice insurance, which means that no lawyer will take a case against them. So, medical tourism, whether it be out of the country or even in the United States, does carry some risks that are significantly greater than going to someone close by. The doctor-patient relationship is just not near as good when you do something like that. And then there's also the risk if you have complications, what are you going to do? You can oftentimes find yourself in a lurch. And especially now in Florida, due to their crazy laws that say that surgeons don't have to malpractice insurance, you oftentimes have little recourse. So if you want to see the full segment, check it out. We appreciate it. So, all right. Next. Still Breast Cancer Awareness Month. We had a very, I thought, kind of happy story last week about breast cancer with Jenna Fisher. This one's a little bit more sad, actually. But I think there's some things to learn about it. And this is about the MTV VJ, Ananda Lewis, opening up about some of her regrets regarding her breast cancer diagnosis. And she was on CNN talking about this. And as I said, it just really kind of bummed me out. She's kind of in a difficult way, I think. I mean, she has a very good attitude about it, and she's very open about it, which I think is great because it can potentially help people. So she's currently 51 years old. She was diagnosed with breast cancer in 2019, so I think she was around 46. And at the time, she was diagnosed as stage 3. And remember, we were talking about stages last week, and stage 1 is obviously very early. Stage 3 is definitely a more advanced cancer, but not as bad as stage 4.
Yeah.
And at the time, her doctors were recommending her to get a mastectomy to remove the cancer. And she actually refused that. She opted for going for a combination of alternative therapies as well as some form of chemotherapy. It didn't really say exactly what she was taking, but some form of chemotherapy. And she said that she responded pretty well at first, or at least that's what she was told. But unfortunately, about 1 year ago, they diagnosed her with stage 4 breast cancer and saying the cancer had basically spread throughout her body.
What?
So, yeah. So that's not necessarily a good thing. Well, flat out not a good thing.
Yeah.
Not a good thing at all. And so, and she was, she was very kind of emotional about it, and it was just honestly emotional to watch it. But she was talking about something else. This is even more tragic. Lewis said that she actually had refused to get mammograms because she was worried about the fear of the radiation. And so she didn't get mammograms, even though she was kind of at that age.
How did she finally get diagnosed with breast cancer?
She felt a lump.
Yeah.
Yeah, and that's
by that time, it's like so late.
Yeah, that's an important. I'm so glad you mentioned that. That is a very, very important factor when it comes to breast cancer. And I think we briefly talked about this last week. That you can't just rely on self-breast exams. You need to find breast cancer early, and by the time you feel a lump, that is a more advanced breast cancer for sure. So as I said, I applaud her for opening up about this. I'm sure it's very hard for her to say these things and talk about, well, I wish I'd done things differently. But, I think the upside is that, I think people can learn from this. When you see somebody high profile like that talk about, this is what I did, I wish I did that. I think
Right.
it hits home pretty hard. And there's some very important points here, and some of this will kind of have some crossover from last week, but this is just so important. I think it's worth talking about again. Obviously the most important thing, getting mammograms, absolutely critical. You hit the nail on the head that, she didn't notice that she had breast cancer or even go seek any treatment until she felt a lump. And by that time, you're talking about a more advanced cancer. And there's a lot of data to show that if you get mammograms regularly as recommended, that there's actually a significant decrease in mortality for those patients who get cancer, meaning women who get mammograms and women who don't. If those two women get cancer, the person who get mammograms is going to have a much better diagnosis because they're going to catch it early. It's like a 40% decrease. I think I pulled that study. Travis, I always like to throw these studies up just so people can, and there's a lot of these studies, but this is one talking specifically about decreases in mortality if you get your mammograms. So she had stage 3 cancer, and last week we were talking about Jenna Fisher had stage 1. It makes a big difference, the stage of the cancer diagnosis, because that weighs heavily on the survival rate.
Okay.
So stage 1 survival rate's 5 years if it's treated, with conventional therapy is 100%. Stage 2, it drops to like a range of 90 to 99%. For stage 3 cancer, it starts dropping fairly precipitously. You're talking about a 66 to 95-ish% survival rate at 5 years. But when it hits stage 4, that's when they say that breast cancer is incurable, and the 5-year survival rate drops down to about 30%.
Oh my goodness.
So that's a pretty insane drop when you go from that 3 to 4. Obviously, it is just so important.
She's going to be going down a long road.
Yeah, and it's
what's
tough.
What's going to feel like a long road.
It's tough when it spreads out into other places. You start to have like symptoms from it, like your life starts to get affected, and your quality of life starts to diminish a bit, just depending on where it's gone.
Yeah.
The other thing that I think is really important in this is the part where she was refused treatment, and no one can say. I mean, it's entirely possible that if she had done exactly what the doctors said, that maybe the outcome would have been the same. But there's a very decent likelihood that if she had done the treatment as they had suggested, that it may have not gone from that stage 3 to stage 4.
Yeah.
And that that makes a huge difference. Doing alternative therapy for cancer never tends to end well. I mean, there is a ton of data to support that. Throw up that second study, Travis. This is just one study. There's tons of these out there if you want to look it up. This one, it looked at several cancers, specifically to breast cancer. For those people that chose alternative therapy versus conventional therapy.
What's like an alternative therapy versus?
It's like the homeopathic stuff, there's a whole laundry list, like changing your diet and eating, all natural foods and, things like that, as opposed to surgery, and chemotherapy, radiation. 5.7 times increased risk of death from breast cancer if you do alternative therapy versus conventional.
Okay.
So, obviously wish her the best in her fight against cancer. And, crazy things have happened. I mean, they say stage 4 is incurable, but you always hear every once in a while of these stories where somebody gets on some new therapy that
works for
makes
them.
a big difference. And, definitely wish her the best and honestly applaud her for, having the courage to talk about her journey with breast cancer. I mean, I'm sure it's very hard to do and say things like, I made a mistake. But if it helps somebody else down the road, then it's not totally in vain, right?
Yeah.
So take home, get your mammograms. I mean, when it comes to breast cancer, I just can't say that. Getting your mammograms and knowing your family history is important. If you have a strong family history of breast cancer, like maybe your grandmother had it, your mom had it, especially if they had it when they were young, you need to be on top of that from a very early age, like even as early as like in your 20s, talking to your doctor about your risks.
Yeah.
Because
my lady doctor knows my grandma had it.
Really?
Yeah.
Yeah.
So.
You're still pretty young. Yeah, you shouldn't
My grandma didn't get it till she was like in her 70s.
So you got a few years before you start doing mammograms.
At least till 70.
Yeah.
Just kidding. No, it's like 30, right? Not 30, 40.
Yeah, 40.
Yeah.
Yeah, it's hard, you get to these ages, I was at the age where I had to go and get like scopes. I'm like, oh my God, this is terrible. Like, I don't want to do this. And I can, it's not the same as getting a mammogram, of course, but just, getting these ages where you gotta start doing things. And it's hard to get into that routine of, oh, I gotta like do like adult doctor stuff now.
Yeah.
But it definitely makes
uncomfortable things.
Huh?
Uncomfortable things.
Right,
that are
exactly. Yeah,
preventative.
uncomfortable things you don't want to do. But I mean, I'm a research guy, man. I look at the data, and the data shows that doing these things absolutely can save your life.
Preventative health.
Preventative health. You know that? You're like the master of health.
That's what my degree's in, pretty much.
I know, right? You should be teaching me stuff.
Yeah.
So, but yeah, we wish her the best, and hopefully we'll see a good outcome for her.
Yeah.
And definitely, I think taking those things that she said to heart is important. So.
Agreed.
All right, moving on to our final segment. This one actually came from a news article as well. All three of these stories came from news articles. I was just kind of flipping through this week and seeing what was out there. And this segment is basically about liposuction and the risk of liposuction injuring your intestines or other organs like your liver or your lungs. And that probably sounds crazy. I mean, to me, I totally get it. I'm going to show you guys some pictures, try and educate you on what all that means. So this comes from a story out of
Florida.
The Florida Medical Board is going after a doctor, I can't remember, Dr. Insafil. This guy's a board-certified plastic surgeon, though. There's an article if anybody wants to look it up.
Was he making a TikTok?
No, actually, that we are going to talk about that. I know exactly what you're thinking. So apparently this doctor, who is a legit board-certified plastic surgeon, had 2 deaths from BBL in 3 months. And another patient that had really severe injuries from a BBL. And so when I hear that, the first thing I think of is, they had a fat embolism. Because if you guys have watched the show before, I hate BBLs. I won't do them. I think they're terrible surgeries. Not terrible, but bad. They carry a very high risk of mortality. And the biggest risk of mortality comes from the fat getting into your bloodstream, which is a very bad problem. It can kill you very quickly. And so I just kind of assumed that that's what it was from. That's what it was from.
Yeah.
Well, the news article goes on to talk about that the patients who passed away had autopsies, and they actually had multiple injuries to their internal organs from the liposuction.
Like punctured by that thing?
Yep, that's it.
Gross.
So I'm not going to, beat this doctor up. I mean, I'm going to talk about the risks of that happening. I will say that having all three of the patients had it too, the 2 that died and the...
does that I feel like that would be like a higher risk for people that it's hard to extract fat from. Like he has to go to areas that are...
That definitely, I think that you are onto something, and that's something I didn't even mention there, but I do agree with you. Like when you're doing, and one of my gripes about...
they're like smaller girls, but they still want to have the BBL, and there's no place to get the fat, really.
I think that when you're struggling to get fat from areas you normally wouldn't maybe go get fat from because you have to have it to do the fat injections for the Brazilian butt lift, you are kind of putting yourself into some dangerous territory, and that's one of the reasons I don't like BBLs.
Where do they usually pull fat from?
I mean, the common areas on women are the abdomen, the hips, the flanks, thighs. But one thing I've noticed about BBL patients when you see the befores and afters on social media, and a lot of people I think don't notice this, they almost look overly skinny. Yeah. Like they've been over liposuction because they need to get so much fat out because it takes a lot of fat to plump up the buttocks.
Yeah, and I always think that with their thighs. It looks like their thighs are not proportional to their...
Yeah, I mean, they just get stripped of all the fat, which is not good. I mean, you need a healthy layer of fat tissue. But yeah, I think you're onto something that whenever, you're doing a Brazilian butt lift and you got to go just hog wild, just grabbing fat from everywhere, that you are probably putting yourself in a little bit of a precarious position. But what I was going to say is, this doctor had 3 internal organ injuries from liposuction in the span of, I guess, a year. I mean, that is a bit of a red flag. I'm going to kind of do a deep dive into how common this is, but it should be exceedingly rare.
Yeah.
I couldn't get any super hard data on the actual risk of perforation of the intestines or organs from liposuction because, one, it is so rare. It's easier to track things that are more common. When something's like a 1 in, 10,000, 100,000, it's hard to track, okay, how exactly common is it?
Right.
Because there's not enough occurrences to track it. So, It's stated to be less than 0.1%, so less than 1 in 1,000. You know, to me, I mean, if I was gonna, I would say that the risk really should be in the tens of thousands.
Okay.
Personally, like I think that most surgeons in their career should never have one of these. And so, you know, I'm trying to think how many liposuctions I've done. I mean, I do 300-400 cases a year times 15 years. I've done 5,000 or 6,000 cases. I mean, I've probably done, you know, a couple thousand liposuctions, maybe 1,000. I don't know. It's hard to say. I'd have to go back and look. But, you know, and so in a career, you might do, you know, a few thousand liposuctions. Yeah, I guess maybe 1 in 10,000. It should be even less than that.
Yeah.
So as far as like how this happens, I did do a little infographic. Travis, can you throw up that little picture there, the next one? I hope it's the picture. Yeah, okay. So if you look in this picture, so the top, that big kind of peach area obviously is the skin. The layer below that's the fat layer. And then that reddish thin layer is the muscle. Oh, there's words there, so it tells you. Okay, very good. So I put a red line where the incision on the skin would be for the lipocannula, and the arrow is like how you would run that lipocannula in, and that long blue line is where you should be liposuctioning, okay? And so what you do is you get that lipocannula in there and you actually shave the underside of the fat going upwards until you get it to the thickness that you want. And if you notice, as you go down, there's that really big muscle layer, and then there's like fascial layer, and then there's like another layer of fat, which is preperitoneal fat, and then you get down into the goodies down there. That's, I think they have intestines, so that'd be like loops of your bowel. And so in order for you to have an injury, you have to go from that blue line layer, which is where you should be, all the way through those layers at the bottom to get to like things like your intestines or your liver. And I'll tell you, it's not really easy to do. That muscle layer is pretty tough.
Yeah.
It doesn't want to allow a big blunt, because those cannulas are not sharp, they're blunt. And they're, you know, roughly about the size of my pinky. I use a 6mm liposuction cannula most commonly, and I do have a 4mm that I use. Obviously, the smaller the cannula, the more likely it is to kind of make a puncture. So the big one's pretty rare. That's the one I use first, just to kind of open
So do you have to like pre-puncture the skin to put the fat, the sucking thing in there?
Yeah, so what I do is I make a tiny incision. I use like so I have to use a 6mm liposuction cannula, so it's about 6mm. I make it basically just big enough to get my cannula through. And the first thing you do is you inject fluid into the fat, and that fluid will decrease the risk of bleeding. It also gives some anesthetic, which hopefully you're doing it while they're asleep, but it reduces pain when they wake up. Once you get the fluid in there, then I first will take the liposuction cannula without suction on it, just to kind of make that space.
Yeah.
I just use it and I kind of feel that muscle layer, and I kind of open up that space between the muscle and the fat. Once I get the space open, then I actually turn the suction on and I start shaving it. And so, you know, I mean,
Sounds like you have to, like, you said it was blunt, so it sounds like you have to really be like being overly forceful to like puncture an intestine, I guess, in that picture.
Yeah, you'd have to really go pretty
Aggressive.
hard, and there are reasons that might happen, and I'm gonna talk about them. But the thing is, you know, you have to be careful when you're doing it. Like I always do my liposuction. I got one hand on the cannula, and I got one hand at the end of that rod, and I'm making sure I can feel the rod.
Yeah.
You know, I don't want to lose the rod, because if I lose the rod, that means it's going too deep.
Yes.
So I can always feel it with my hand. I'm just kind of going like this and making sure I know exactly how deep that thing is. And it doesn't want to just dive under the muscle. Like you have to kind of get off the road a bit for it to do that.
Yeah.
You know, you hold it so it's transverse, so you're not doing like this.
Yeah.
And you can kind of feel exactly where it is. So if you're taking care, the chances of you puncturing that layer and getting in deep are pretty low. Now, it's not zero.
Okay.
Even people who are careful, it could happen. And there are some reasons that might happen. So one is if you've had a lot of surgery. I was literally doing liposuction this morning. I did a tummy tuck with lipo, and this lady had previous surgeries, and where those incisions were on her abdomen, there was scar tissue, and like my cannula was just not wanting to go. And so like that first part where I was opening things up, I was really focusing, okay, I want to make sure, because you're pushing harder. When there's scar tissue, it's harder to get it to go.
Yeah.
And you're really pushing, and that's where you potentially could get into trouble.
Yeah.
And you just got to make sure that you're not going at a bad angle, like you know how deep it is, and then you basically get it open, and then you're good. But I was, even this morning, I was like, oh my gosh, of course, obviously I'm always paying attention, but I was like, man, I just prepped for this thing about hard liposuction, and here you have one.
Yeah.
But that's one reason that people can be a higher risk for an injury. Others, when people are obese,
Okay.
You know, if people are obese, it's harder to tell where your cannula is, and that can be a problem.
Like too much is not always a good thing.
Yeah, it's really not. And honestly, like doing liposuction for obesity is not a good plan. Liposuction is not a weight loss procedure. It is a contouring procedure.
Yeah.
It's for taking an area of fat that looks like it shouldn't be there and taking it away. It's not for trying to reduce a significant amount of fat tissue that really
it's not for like
It's not for
health.
weight loss.
Yeah, it's not for health.
Yeah, it's not for weight loss. You know, another reason that people might get in trouble is if they have an undiagnosed hernia. So a hernia is when your intestines get through that muscle layer and you had like a loop. I actually had a patient that I found a hernia on that I didn't know they had. I always check people for hernias, but they were a little bit thicker. And I found a hernia, and thankfully it was a patient that I wasn't doing liposuction on, so there was no problem. I just found the hernia, I fixed it, and we all went on our way. But potentially that could be problematic if you were
That's crazy. So like she just woke up and you're like, so you had a hernia and I
Yeah.
fixed it.
Yeah, basically. I mean, that happens I'd say that happens to me once or twice a year where I find a hernia.
wild.
I'm really good about checking for them because I don't want to like get into any trouble. The reason I didn't go ham looking for this hernia where she had it is an area I wasn't liposuctioning.
Yeah.
You know, I looked at all the areas I was going to lipo. I was like, you're good, nothing there. But in the area I wasn't liposuction, I was like, oh, hernia. All right, let me fix it. But, you know, if you're not careful and you don't check, like you could run into trouble like that. You could puncture the intestine when it's in a spot where it shouldn't be.
Yeah, definitely. That makes total sense.
Actually, I did write BBL. So that thing that you were talking about, we're having to do a lot of liposuction. I did actually. I wrote that down. I didn't remember. So that's a
there
good
you
one.
go.
Yeah, we're smart. Yay, high five. Other reasons, if you're getting liposuction under local, I'm not a big fan of this. I do it from time to time for very, very small areas on patients that I feel really strongly that they're going to do okay. The risk you run when you're doing liposuction under local is if somebody jumps at the wrong time, you know, you're running this thing on a track, right? And if you suddenly cause pain to them and they jump,
Oh gosh.
that thing could go off course, and if they jump the wrong way, you could cause an injury. So that's why I'm not a huge fan of doing significant liposuction under
No,
local.
thank you.
And the last thing would be when you have non-plastic surgeons performing it. I mean,
Yeah.
that is problematic. I mean, people think liposuction is just like sculpting a block of ice or something. It's not. You can literally kill someone doing it, and you need the right training, and you need, you know, to be vetted that you know what you're doing. Because if you do puncture, you know, an intestine, it's a bad problem. Like you're talking, you are going to be at best extremely
So
sick.
those patients like just didn't wake up.
No, one of them. Okay, so one of them died on the table, if I remember correctly, and the other died like a day or so later.
So it's like if so the
It depends on
procedure-
what you rupture.
Yeah, so the procedure is if the doctor ruptures something, they're hopefully they stop.
You may not know it.
Oh my god.
Oh, you may not know it. No, like you see, I think one of them got a punctured liver, and I think they just kind of bled to death.
Oh.
The other one punctured the intestine, and that's not going to kill you right away. What's going to happen is over the span of a day or so, your intestinal contents leak out inside your abdomen, and you get super sick. And then you end up with like a colostomy and multiple surgeries. I mean, it's a bad deal. That's if you survive. Mortality rate for punctured intestine or organ is around 16%. Pretty high. That's the death rate. If it happens to you, it's like getting shot almost. You know?
Yeah.
It's not that you don't get the same kinetic energy of a bullet.
Well, somebody stabbed you.
Yeah, it's like, or getting stabbed. That's a better, yeah, it's like getting stabbed with like
Yeah.
a long, pointy metal rod. It's not good. So bad stuff. So you got to be careful. Like you want to go somebody, you know, board certified, knows what they're doing. You know, you were talking about were they on social media, like that, you know, they're paying attention, not doing TikToks or whatever.
Yeah.
Remember that one doctor?
Yeah, that was just like, and with that video, she was just
oh my gosh, it was scary,
it was
right?
like in that person's neck.
In the neck too. I was like, oh my god.
Why would you get liposuction in your neck? One.
Oh, we do it. It's common. I've done it. Yeah,
Really?
many times. There's certain people that, you know, certain people gain fat in unusual areas, and like the
Cool.
neck
Yeah,
is
yeah.
one of them. I mean, and it makes a difference. Like,
I mean, yeah.
they look pretty good. I mean, if you don't have the problem, it's like, yeah, why would someone
Why
do
would
that?
you do that? But
Yeah, why would
I
you do
guess
that?
if you
So-
need it, then.
But crazy stuff. All right, let's recap that one real quick, Travis. Today we were talking about liposuction and the rare but extremely dangerous risk of the liposuction cannula puncturing your intestines or other organs. This comes from a story out of Florida where it happened to a certain surgeon 3 times in a year, which is crazy. This is something that should be exceedingly rare. Risks of this should be way less than 1 in 1,000, in my opinion, maybe 1 in 10,000 or more. It definitely shouldn't be happening a lot. It can happen if you have certain risk factors, such as if you're obese, you've had multiple abdominal surgeries, if you're getting liposuction under local, which is not a great idea, I think it's higher with Brazilian butt lifts because they're having to get more fat out than they normally would. Also, if you're not going to a board-certified plastic surgeon, I think it's going to put you at more risk. And this is a dangerous thing. If you get an injury to your intestines or an organ, you will absolutely get very, very sick, likely need multiple surgeries, and there's a pretty high mortality rate for that. It's around 16%. So although puncture of the organ or intestine is very rare with liposuction, it is a very serious thing, and I think knowing about it can help you maybe prevent that from happening. So, all right.
And then real quick, Dr. Herman, Janet Atterbury, she said, great show today. Love the topic.
Thank you, Janet. Thank you for chiming in. We really appreciate that. Hope you found it entertaining. So, all right. I think that's all the time we have for today. Thank you guys so much for tuning in. We do appreciate it. Please leave us a comment if you want us to talk about something specific on the next episode of Nip Talk.
Bye.